So there's shoulder pain with overhead pressing. The question now we can look at is, well, are you doing them seated versus standing? Is one better than the other? If you have shoulder pain, should you be doing one versus the other? And again, unfortunately, like most things, it kind of depends on a number of the things that we already talked about, right? The soft tissue mobilization, your thoracic mobility, your overall posture. But sitting down, I should say, seated overhead presses do give you some ways to work around things a little bit more than standing does. But there's also things you can do to cheat around that. So let's jump into and take a look at the seated overhead press. So let's take a look at the seated overhead press. So you're going to be sitting typically on some kind of a bench with the back brought up that typically is slightly angled back. It could be completely vertical. It won't really matter too much. Here's the rub on that, or the trick. So if you think about pressing on a bench, right? So if you lay the bench all the way down flat, right? That's a bench press. The more you incline the bench, the more difficult the movement becomes. So if this is completely vertical, it's going to be more challenging than if you laid the bench all the way flat and it was horizontal. So when you kick it back one click like this, it does make the movement, relatively speaking, a little bit easier. So keep that in mind, that if you lay it back too far, basically it was more of an inclined chest press, but having a slight lean back might be a little bit easier to kind of set things up. But seated overhead presses, and listen, both are fine. Seated overhead presses versus standing overhead presses, both are good, right? Now, seated does allow you to have to focus on fewer things because you're sitting down. The bench is supporting you. There's less sort of less body mechanic things you have to worry about. But there are things that people often do that can contribute to their shoulder pain while they're overhead pressing. And this would be true. I will talk in a later video about barbell overhead pressing versus dumbbells versus kettlebells and things like that. But the basic idea here is that one of the issues what people do is when they're here, they arch their back even more. So even if there is a slight incline, if I do this, I've now turned this into a bit more of an inclined bench press because I'm arching more. The problem is I'm actually jamming up my neck and I'm creating more problems in through the shoulder and the neck area. So if you're going to set up here and you're pressing, your press needs to be here. You shouldn't be really arching away from the bench. And you also want to avoid really driving your head back against the bench. And this is really true for a lot of exercises. When you jam the head back, you can create a lot of stress in the neck area. And when you press, it's a vertical pressing motion, right? So if I'm here, I want to be pressing straight up this way. So I'm straight here. A lot of times people's overhead pressing start to drift out in front of them. Whether or not they're aware of it is another story, but what you're doing is you're putting a crazy amount of stress on the shoulder the more it drifts out in front of your body. So make sure that your vertical or your overhead press is a vertical motion. Now, this will come all the way back to the things we've already talked about in terms of postural awareness, thoracic mobility, or even if you're stuck here and you're going to end up drifting forward until you can get yourself back and you have that available range of motion. So make sure, go back and address those things we talked about prior to getting back to doing any kind of really heavy or consistent pressing, seated or standing. Now, let's talk about standing overhead presses. So say you do all of your pressing, no matter what kind you do, standing, what can be some of the problems that you may encounter with standing? So obviously when you do a standing overhead press, there's more balance requirements, there's more stability requirements that you have versus when you're sitting. You also don't have the ability to push back against the bench for added stability. So you have to create that stability on your own, which can be part of the problem. A lot of times what I see and what is common is the low back really kind of gets, especially if there's limitations. If we're locked in here, people are going to get really arching through here to try to press. Now, that could create problems for the low back, sure, but when the low back arches, right, so your lats, right, so take a look here, your lats run from the low back area, what's called the thoracolumbar fascia, up towards and it connects to the arm bone. So they have some role in overhead pressing motions, not directly, but indirectly, because when they're tight, they're going to limit your ability to get here without arching the back. So that, again, throws off the mechanics of the entire body, because now the low back is arched, the hips are now kicked forward, and then it throws everything off here, because now you're not in a good position here, you're compensating through here, and then your press is going to be off from there. So that's one of the things that you typically see with that. And then the other things too is, again, I mentioned it in the seated video, is that the press actually starts to drift forward a little bit, and it becomes more this way instead of there, because you can't actually get to this position, right? Basically you get stuck, so then either the head has to jam forward, or the back arches, or the press kind of comes out, all of which are compensatory in nature and not desirable. So really, when you look at overhead pressing and standing, what I would suggest, and what we're going to talk about, is making sure that you can lock everything in, and that you're very aware of your low back position, even though it's not directly tied into shoulder pressing. It's an important component for setup. So make sure this is set first, whether you're pressing with a barbell, dumbbell, kettlebell, or whatever. Really control those things. And like I mentioned with the seated overhead press, you need to address the other mobility issues first. Get your postural awareness in check, both static and dynamic posture. Get your thoracic mobility in check. If it's not what it needs to be, address that. Get your soft tissue work in, then come back and revisit and sort of revamp your pressing technique. Don't just continue to press with lighter weight thinking that's going to solve the problem. Address the mobility things first, then come back and revisit your pressing technique.